Namaskar. This is Dr. Alok Roy from Medica under the banner of Health is the Ultimate Wealth. Like every week, we are here again on Saturday between 5:30 to 6:30. We always bring some new topic. This time, one of the listeners had asked for that what about sleep, snoring and sleep apnea. So we got the best for you, Dr. R.K. Das. Dr. Das is our pulmonologist, a very senior pulmonologist with Medica. He brings years of experience and wisdom. So today he will talk on sleep apnea and its effect on health, which is related to snoring. Dr. Das, over to you.
Good afternoon. It's really a pleasure to be with all of you in today's webinar. And I'd like to thank Dr. Alok Roy for giving me this opportunity. So today we'll be talking about snoring, obesity, and sleep apnea. And we'll also discuss about its effect on health. Now, snoring, when it comes to the issue of snoring, that it is practically a disease that is not realized. But the new researches that have come in have placed it as a very important issue in our health scenario. Right at the beginning, what I'd like to discuss a few real life patient stories to you. I think you'll be able to identify the symptom pattern in the society. The first patient I'll talk about a 45-year-old lady who was in a very high official in a corporate setup. She was obese, she used to snore, and what she recently developed that she used to feel very sleepy in the daytime. And in one such board meeting, actually she had started snoring. That was the time when she realized that something has gone wrong. Another patient I'll talk about is about a lawyer who was from Guwahati. He came to the clinic with again a complaint of excessive daytime sleepiness. He was also obese and used to snore at night. And in the courtroom, actually, he slept off and started dozing. Another young person aged around 30 years, she was riding on a bicycle, on a motorbike over a bridge here in Kolkata, and he slept while driving. He crashed his bike. He also had the same issues of snoring. He was slightly obese. So now I've given you three examples of patients. These are real patients that we have dealt in a clinic. Now, I'll ask you to realize what is the common factor that binds all these three. There's only one issue that connects them, is that they have excessive daytime sleepiness. This excessive daytime sleepiness has its relation with snoring, and they are also obese. And now this disease that we are discussing is called obstructive sleep apnea syndrome, in short OSAS or OSA. And today we'll be discussing about this particular disease. Now, when we discuss about snoring, normally what happens when a person snores while sleeping, it is a common feeling that he is having a very sound sleep. বাংলায় বলতে গেলে নাক ডেকে ঘুমোচ্ছে মানে খুব ভালো ঘুমোচ্ছে। In reality, The opposite is true. A person who snores during sleep, he doesn't have a sound sleep at all. And this is what our purpose of discussion today. And for that, we need to go into the science of sleep itself. We have to know something about what sleep actually is. So we'll try to understand few basics about sleep. Then we'll try to find out why snoring occurs and the relationship between snoring, sleep disturbance, and excessive daytime sleepiness. And we'll also try to tell you what are the symptoms, the long-term effects, and the diagnosis and the treatment. See, human beings probably snored from the time they lived in caves, and it has been described in Greek literature and also in work of William Shakespeare. But the classic description of a sleep apneic is given by Charles Dickens in the novel Posthumous Papers of Pickwick Club, where he described a character called the Fat Boy Joe. He is a classical example of a very severe form of sleep apnea patient. But this particular disease is actually recognized as a clinical condition only after the researches brought into the various facets in last 55 years or so. This is what I mentioned from Charles Dickens' novel, The Character Fat Boy Joe. This is the artist's impression of obesity, which related with excessive daytime sleepiness. The person is to fall asleep anywhere, anytime. A bit of historical background. In 1918, William Osler first identified the relationship between obesity and Pickwickian syndrome. Initially, based on the Charles Dickens novel, this particular disease was also known as Pickwickian syndrome. Later in 1965, Jung and Culo, and in 96, Gaston, Tassini, and Duron, they noted that the occurrence of recurrent apneas means cessation of breathing during sleep, and they suggested that these cessation of breathing resulted in sleep disruption and which led to daytime sleepiness. Now, the concept of sleep is not one particular type of pattern of activity in the brain. It is not like switching on and off a light, like you put it off and with a switch you put it on. Sleep is a very complex phenomenon, and the researches that brought into forth these aspects was first by Hans Berger in 1928. He first recorded the electrical activity of the brain, which is known as the EEG. In 1953, Aserinsky and Kleitman from University of Chicago first described the presence of REM sleep. REM sleep means rapid eye movement sleep. In 1957, Dement and Kleitman described the cyclical variation in EEG during sleep and the relation with eye movement. So these are the two very important understanding in the sleep research that changed our very concept of what sleep actually is. Normally, sleep has two broad types. As I mentioned, one is the non-REM sleep and other is the REM sleep. Now, when a person from wakefulness state enters into sleep, he enters into non-rapid eye movement sleep, and it has 4 stages: stage 1, 2, 3, and 4. Now, stage 3 and stage 4 is clubbed together. So it has been now described. Non-REM sleep has 3 stages, and then the REM sleep comes in. It comes in a cyclical manner, like a person, when he enters into sleep, he enters into non-REM sleep, which lasts anything between 40 to 80 seconds, which is followed by REM sleep, which lasts for about 10 minutes. This is one of the pictorial diagram to which shows like here you are awake, and then you enter into stage 1, stage 2, stage 3, and stage 4. This lasts for about anything between 40 to 80 seconds. And after that, you enter into a phase of REM sleep. This REM sleep lasts for about 10 minutes. Then again, you go into the stages, the deeper stages of sleep. And these cycles keep on recurring for at least 5 to 6 times during a whole night sleep. And how do you identify these stages? It is by recording the EEGs. If we record the EEGs during sleep, you can identify which stage of sleep the person is in. So these are the EEGs taken during the different stages. So this is the basic normal architecture of sleep. Now, what happens in sleep apnea, this is very important. I'll try to explain to you in this cartoon. These pictures actually depict, you can easily understand, this is the person lying on the side, and what I'm trying to depict here is that this is the nose, and from here, air enters into the nasopharynx, and from here, from the back of, this is the tongue, from the back of the throat, it enters into the trachea and then into the lungs. That is a normal flow in a normal person. What happens in sleep apnea is that as a person goes to sleep, the muscles of the tongue and the soft palate, their muscle tone, they decrease. With the decrease in muscle tone, these muscles, they fall backwards. See, this is what the space here is there in a normal person. If the muscle tone falls below what is normal, this passage is partially occluded. And as air tries to enter from here, it vibrates and creates a sound of snoring. This is the basic origin of snoring. As the person snores, actually what happens, the entry of air into the trachea and the lungs decreases. Now, suppose if the muscle tone falls further, what actually happens? This passage is totally occluded. And with the result, air cannot enter into the trachea. This is called, what I showed you is called hypopnea or partial cessation of breathing. And what happens here is apnea or complete cessation of breathing. Now, I think I now go back to the earlier sleep hypnogram. If you see this, what I mentioned here is the normal sleep in a normal person. This is the what happens, all the stages. But in cases of obstructive sleep apnea, as the person enters into stage 1, the passage through which the air passes, they gets narrowed, and there is a micro arousal. At the most, the sleep may enter into stage 2 by the time the passage has already occluded, and it never enters into the deeper stages. The signal goes to the brain to wake up. Why? Because as the passage is occluded, the body's oxygen level falls. And when the oxygen level falls, the message is given to the brain to wake up, And with that momentary wakefulness or micro arousal, as it is called, there is sleep disruption after stage 1 and 2. With this, it goes into wake, and then again into stage 1, there is again sleep obstruction of the air passage. So what happens in a sleep apneic patient? There is only stage 1 and stage 2 sleep with no REM sleep. So the normal sleep architecture is completely disrupted in cases of patients who are suffering from sleep apnea. And the result is that the patient becomes sleep deprived. This is what we need to understand, the basic issue that lies the pathophysiology of a sleep apnea disease. Now, how common is sleep apnea? It's a very common disorder. The most common quoted study is the Wisconsin sleep cohort study, which was conducted in USA, which revealed 9% of middle-aged men and 4% of middle-aged women had a respiratory disturbance index of more than 15. This means that every hour there are more than 15 episodes of cessation of breathing. Now, I must clarify a bit on the respiratory disturbance index. You have already learned what is apnea and hypopnea. That is cessation of breathing or complete or partial cessation of breathing. In normal people, the RDI or the respiratory disturbance index is less than 5. If it is more than 5, then you label it as a person probably having sleep apnea. In Kolkata, we undertook a study where we studied it by using a Epworth sleepiness scale. That is a questionnaire form where it estimates the daytime sleepiness, and that is related with OSA, and we found a prevalence of around 10.7%. Now we must discuss how does the obstructive sleep apnea patients come to us? What are their complaints? To be truthful, most snorers, they don't complain. They are quite a sleepy lot. They snore, they sleep during wherever they are tired during daytime, and wherever they sit, they can doze off. So they primarily, they don't complain, but some people may come and say that it's a severe problem, it is hampering my work, and I doze off anywhere. Even while driving, I feel like falling asleep. You can easily imagine the risk associated with it. Whether you are driving your own car or you're driving a train or a truck, you can imagine the risk involved. There's another complaint that usually brings the patient to the doctor. It is the person will come, he says that when I go to sleep, I suddenly feel choked and I wake up gasping for breath. This is one of the very frightening symptoms, and they usually bring the patient to the physician, and the alert physician will, if you ask about whether the person snores, if the person is obese, you are almost certain that he is suffering from OSA. If the husband is snoring, the wife at times will complain, the spouse can complain that he is snoring to such a level that I cannot sleep at all. And there are some evidence where actually the spouse has to wake up, just shake up her husband and just to wake him up so that he starts breathing again. And there are times when they can, with a clock, they can actually measure the amount of time that they have stopped breathing, and that they can tell the doctor, look, when he's after snoring for some time, he suddenly stops breathing, and for about 10 seconds or 30 seconds, which at what time I feel that whether it's going to breathe again, I have to just waking up. So these are the, some of the symptoms. Another symptom, very common symptom is, doctor, I keep on forgetting things. Lack of concentration, loss of memory, diminished ambition. Patients remain socially isolated. Some are irritable, and there is personality change in some. So these are some of the symptoms associated with OSA. Loss of libido is another important but not well recognized symptom that is related with obstructive sleep apnea, and this must be understood, and treatment of OSA actually corrects this particular problem uniquely. So to summarize the symptoms, the nighttime symptoms are loud snoring, witnessed apneas, where the spouse can actually mention that I actually see him not breathing for maybe such and such time. Nocturnal awakening, gasping or choking episodes, the most frightening symptom that they present with, and increased frequency of urination during sleep. This is another symptom. Daytime symptoms, normally after a good night's sleep, a person should wake up fresh. But sleep apneic patients, they have unrefreshing sleep. They may have morning headaches. Excessive daytime sleepiness, we have already discussed. Automobile and work-related accidents due to this excessive daytime sleepiness is an important issue. Irritability, memory loss, personality change, and decreased libido are the other features. Now, one of the important is that why should we bother about sleep apnea at all? Now, sleep apnea affects various systems in the body, be it cardiovascular, respiratory, neuropsychiatric, endocrine, urological, all. But the most prominent effect that occurs is in the cardiovascular system. OSA is one of the cause of raising the blood pressure or hypertension. Increased blood pressure, one of the risk factor of hypertension is OSA. Ischemic heart disease is a very concomitant of OSA. Why so? You can easily realize that during sleep apnea, the body's oxygen level keeps on falling repeatedly. This has an effect on heart, and cardiac dysrhythmias are also common. Heart block, supraventricular and ventricular arrhythmias are common. In fact, ischemic heart disease and heart attack, cardiac arrest, myocardial infarction in early morning in OSA patients is quite common. The respiratory effects are because of reduced oxygenation. There can be increased in carbon dioxide level. This can cause drowsiness during day. Raised pulmonary artery pressure due to repeated hypoxemia due to OSA can cause breathing problem on exertion. And cardiac failure due to respiratory problem, which is known as cort pulmonale, is also a feature. Neuropsychiatric effects are changes in personality, depression, neurocognitive impairment, like as I mentioned, the forgetfulness. These are very common concomitant of OSA. Endocrine and metabolic effect, diabetes mellitus and insulin resistance is common amongst OSA. Amongst the urological effects, nocturia, enuresis, and excessive secretion of atrial natriuretic peptide are common. And reflux esophagitis and sweating during sleep is common amongst OSA patients. Now, coming to, we have, I think I can be able to explain to you that OSA is quite a important issue. it needs to be diagnosed. Now, if you are aware of the symptoms, most of the cases can be diagnosed based on the symptoms and the physical characteristics, like the person is obese, he snores, they usually have short neck. And what happens with this, the fat deposition around the neck being large, their respiratory passage becomes narrower and they tend to be more prone for sleep apnea. For diagnosis, besides the history taking, the gold standard of diagnosis is what is called as the sleep study or a polysomnography. Poly means multiple, somno means sleep, and graphy means recording. So recording of sleep due to multiple channels is known as the polysomnography, and this is the ideal test for diagnosing and confirming the presence of sleep apnea. What is done in this? The multiple channels are recorded. Electroencephalogram or EEG, electrooculogram, electromyogram, these are the neurological channels that actually defines the stage of sleep the patient is in. Nasal airflow, snoring detector, and chest wall movements and abdominal wall movements, these actually measure the movement of the respiratory system and whether air is actually entering in adequate amount in the chest. Pulse oximetry and body position are the other parameters that are recorded in the sleep. Usually, this test is a sleep apneic patient, say suppose he goes to sleep around 11 o'clock. At around 10, the patient, all the electrodes are connected by 10 o'clock. And with the electrodes connected, the technician actually places him in the proper sleeping position and he goes to sleep with all these electrodes, and all the recording is done under supervision. So this is one page I'd like to show you. It looks too complicated, but to just very simply put, you can see this graph here. These are the EEG measurements, electromyogram measurements, electrooculogram measurement, and you can understand this. This is the nasal airflow. With every breath, the air is entering into the lungs. But in a sleep apneic patients, after certain breath, as the passage is choked, you find here no movement here. So this is the phase of apnea. Whereas the abdominal and the chest wall and the abdominal wall movement is still persisting. So here there is respiratory efforts, but air is not entering into the lungs. So this is what the polysomnography detects in the evaluation. And here is one polysomnogram data in a 5 minutes page, which shows that you see here the nasal airflow, which is normal. Then it complete cessation of breathing, nasal airflow. So this keeps on repeating multiple times during the sleep. So this particular test actually helps in diagnosing obstructive sleep apnea. Now, coming to the treatment, the best treatment for sleep apnea is by using a machine called as the CPAP, continuous positive airway pressure. This is one such equipment. And what actually is done, this is operated by electricity, and there is this mask which is applied over the nose, and there's a hose through which it is connected with the machine. And as the person sleeps at night, he puts it on, the mask is put on the nose and the machine is put on. And the aim is to put in air at a high pressure to open up the collapse passages in the nose and in the pharynx, so that the sleep apnea, the basic pathophysiology, can be reversed. Now, coming to the other modalities of treatment, as I mentioned that most patients are obese. So, reducing weight also helps in reducing the degree of apnea. Then there comes the other treatment like surgery. Surgery also plays a role in treatment of sleep apnea. Now, some patients will have anatomical deformities in the chin or in the throat, where the air passage becomes blocked by soft tissues. Opening up these by surgical method is a treatment of choice in those cases, but primarily CPAP remains the treatment in cases of OSA. Orodental devices are also used in cases of sleep apnea, where these are tailor-made devices where the devices are placed within the oral cavity. The idea is to keep the tongue and the mandible forwards so that the air passage posterior to the soft palate and the tongue can be kept open. So, with this, I think I can draw close to this discussion, and if there are any questions, I'll be very happy to answer.
Thank you, Dr. Das. Thanks for a very, very well summing up and giving details about sleep apnea. Now, you said primarily that the obesity is the reason for. At what age have you seen the youngest patient, and who's the oldest patient?
Yeah, that is a very good question. See, sleep apnea has also been observed in infants also. And some of the cot death in cots has been attributed to obese infants who actually choke during sleep. And some of these deaths has been considered as a form of obstructive sleep apnea. So any age can be, this disease can affect any age, but the middle and elderly people are most commonly affected. And sleep apnea is more common amongst obese, primarily because the fat deposition that occur in all part of the body, whether it is in the chest or in the abdomen, wherever it is, it also occur around the throat. And that actually decreases the air passages.
डॉक्टर साहब, आपने जो बताया कि जो है सडन कॉट डेथ, तो बिस्तरे पे अचानक बच्चों की मौत हो जाना, ये जो है वो इसका एक बड़ा कारण है स्नोरिंग और स्लीप एपनिया, जहाँ पे सांस लेने में ऑब्स्ट्रक्शन होता है और बच्चों को डेथ हो जाती है. ये कितना कॉमन है या बहुत रेयर है?
Well, it is rare. It is rare. I mean, people need not panic about it. लेकिन जो है अगर बच्चों में अगर स्नोरिंग होता है छोटे बच्चों में, या वेकिंग अप बिकम्स क्वाइट अ प्रॉब्लम इन, फिर तो इसमें ध्यान देना चाहिए. बट इट इज नॉट कॉमन एट ऑल. आई नीड नॉट पुट पैनिक बटन, प्रेस द पैनिक बटन.
सो डॉक्टर साहब, बच्चों में किस उम्र में कॉट डेथ कॉमन है, हो सकती है?
बेसिकली इन इन्फेंसी.
इन्फेंसी, बहुत छोटे बच्चों में, 1 साल से कम.
हाँ, बट दिस इज वेरी रेयर.
जो ओबीज है.
हाँ, it is not a common that are, but amongst adults it is the middle age that is most commonly involved.
Okay, डॉक्टर साहब, आपने कहा कि आपने बताया इसके जो एक तो जो आपने बड़े साफ साफ बताया, which my viewers must note, कि जो है ये जो स्लीप एपनिया है या जो रात में स्नोरिंग के साथ जो उनकी सांस बंद हो जाती है, इसमें जो है मरीज खुद कभी शिकायत नहीं करता है या बहुत कम करता है। उसकी सबसे बड़ी शिकायत ये होती है कि उसको दिन में बहुत नींद आती है, जो समझता है कि हो सकता है रात में ठीक से सोया नहीं हो। लेकिन जो रिस्पॉन्सिबिलिटी है उनके स्पाउसेस को, their spouses have to be very careful. They have to bring their husband or partner to the doctor in early stages. डॉक्टर दास ने ये भी बताया कि जो है कई बार वाइफ डर के उठ जाती है कि तो सांस ही नहीं ले रहा है और उसको धक्का मारती है, हिरारी बुलाती है, तो फिर उससे अचानक उसके साथ आती है। दैट मीन्स वो जो है 10 से 30 सेकंड तक उसकी सांस बंद हो जाती है। These two are very dangerous signs. Is that true, Dr. Das?
Yes, yes. This is one of the very common problem that actually जो है इसी डर के मारे actually patients को डॉक्टर के पास ले आते हैं। That is जो choking episodes है, सांस रुक जाना, वो सबसे खतरनाक सिम्टम है जो पेशेंट को एक्चुअली डॉक्टर के पास ले आते हैं।
डॉक्टर साहब, आपने ये भी बताया कि अर्ली मॉर्निंग हार्ट अटैक इज सीन इन पेशेंट्स जिनको जो है ये स्लीप एपनिया की प्रॉब्लम है। ये कहाँ कितने प्रतिशत लोगों में देखा जाता है और इसका रिलेशनशिप क्या बहुत ही क्लियरली एस्टैब्लिश्ड है कि अभी भी हम लोग रिसर्च के डोमेन में है?
दिस हैज ये जो है एस्टैब्लिश्ड है कि जो पेशेंट्स को हार्ट अटैक अर्ली मॉर्निंग हो रहा है उनके लार्ज नंबर ऑफ देम हैव स्लीप एपनिया। स्लीप एपनिया अभी जो है इज कंसिडर्ड वन ऑफ द मोस्ट इंपॉर्टेंट रिस्क फैक्टर इन इस्केमिक हार्ट डिजीज। 10 साल पहले इट वाज नॉट सो, but now obstructive sleep apnea is considered one of the very important risk factors in hypertension, ischemic heart disease, and even in diabetes. These are the new research जो है ये अभी it has brought to light. So one has to be very cautious about presence of sleep apnea. अगर है तो उसको ट्रीटमेंट करना will help not only डे टाइम जो काम है उसको इम्प्रूवमेंट नहीं करेगा बट प्रिवेंटिव एस्पेक्ट विल आल्सो फॉर हार्ट डिजीज, इस्केमिक हार्ट डिजीज, इसको भी प्रिवेंट कर सकता है।
डॉक्टर साहब, डॉक्टर दास ये बताइए कि डायबिटीज के ऊपर स्लीप एपनिया का कितना असर पड़ता है और क्या क्या असर पड़ता है?
वन ऑफ द वेरी इंपॉर्टेंट ये ऑब्स्ट्रक्टिव स्लीप एपनिया में जो इशू है वो है रिपीटेड ऑक्सीजन जो ड्रॉप होता है वो एड्रिनर्जिक ड्राइव को बढ़ा देता है और इंसुलिन रेजिस्टेंस का कारण बनता है। दैट एक्चुअली हेल्प कॉजेज डायबिटीज टू रिमेन अनकंट्रोल्ड। सो करेक्शन ऑफ स्लीप एपनिया also helps in controlling diabetes in a better way.
तो आपने कहा डॉक्टर दास ने हमें बताया कि डायबिटीज का कंट्रोल जिनको स्लीप एपनिया होती है उनमें अच्छा नहीं होता।
हाँ, तो इसीलिए स्लीप एपनिक जो है उनको अगर डॉक्टर को सजेशन होता है कि ही इज ओबीस, ही हैज डे टाइम स्लीपीनेस, उनको फिर इन्वेस्टिगेशन कराना जरूरी है। डायबिटीज कंट्रोल तो अपने हिसाब से चलता रहेगा लेकिन स्लीप एपनिया जो है वो अच्छी तरह से कंट्रोल होगा तो डायबिटीज भी बेटर कंट्रोल में रहेगा।
डॉक्टर साहब, कैन स्लीप एपनिया कॉज डायबिटीज?
दैट हैज नॉट बीन प्रूव्ड बट बोथ आर इंटररिलेटेड। पर्सन हु हैज डायबिटीज उनके अगर स्लीप एपनिया होगा तो डायबिटीज कंट्रोल में प्रॉब्लम होगा। प्राइमरीली वेदर स्लीप एपनिया कैन लीड टू डायबिटीज that has not been well defined, that is still in research.
So I can put your statement that sleep apnea may not cause diabetes, but if you are a diabetic and you have sleep apnea, you'll have a worse form of diabetes.
Control becomes difficult and sleep apnea needs to be controlled.
Very good. So इन्होंने ये भी बताया कि हमारे साथ very important thing which he mentioned, which in the middle-aged men we must understand that decreased libido, their ability to be in relationship with other partner becomes less. And Dr. Das ने ये कहा कि if we treat them well, it becomes completely reversible and they get their natural libido. Am I right, Dr. Das?
Absolutely. There are quite a few patients, they come and thank me for that. They never actually realize that after starting with CPAP, their sex life has totally changed. They come and
Right.
silently they tell in my ears that you have changed my life, doctor. So in
Very good.
one or two instances, I have got the credit for that also.
So obviously, it's a very important
Yes.
aspect of conjugal life, and that cannot be ignored. So, Dr. Das has very clearly demonstrated कि जिन लोगों को snoring होती है, who snore, and whose breathing stops while they are snoring, are liable to get bad diabetes, liable to get ischemic heart disease. They can die because of sudden death. They can meet with an accident while driving. And they can they sleep on the boardroom. They wherever they are, they find opportunity. They sleep. So obviously their concentration lapses, their the irritability, personality change, diminished ambitions. It doesn't affect physically. It also affects you, your performance-wise in the real world. He also said that lack of concentration, loss of memory. We all know hundreds of people who suffer from it, but very few take it forward and get themselves treated. You can save yourself a lot if you get this disease taken care of. Dr. Saab, one of the last questions I have is there any natural way of treating it? You have said two things, CPAP or surgery. Those who have जिनके anatomy में problem है, they can get surgery done. Or CPAP, positive pressure breathing. Dr. Saab, is there any way, and you said control obesity. So if somebody controls obesity, somebody loses weight 20 kg, 30 kg, will he lose sleep apnea completely?
Yeah, this is another very important issue. Yeah, obesity, there are two issues. One is diet, and the second part is losing calories by weight. Now, sleep apneic patients are always drowsy. They are tired. Making them do exercise and losing weight is a challenge. Most of them, it is just impossible for them. Once they are put on CPAP, they become active. And strikingly, वो exercise भी they can do like a normal person. आपने बोला कि what are the other non-machine management? There is one simple thing that can be done is sleeping on the lateral position. Patient who sleeps in a supine position, they tend to get more of these apneas, hypopnea episodes. Lying on the lateral position will reduce snoring. So there are many ways. Even some have put tennis balls in one side so that they just don't go. They put tennis balls in the back so that they cannot sleep in a supine position. They have to lie on one side. Then there is another way of reducing this. This thing is by start with CPAP, and after that try to reduce weight. And once weight is reduced, then the sleep apnea, degree of sleep apnea reduces, but it doesn't goes away. That is, one has to realize sleep apnea, once a sleep apneic, always a sleep apneic. So even obesity is a very common concomitant of OSA, but occasionally we have found even thin people to suffer from sleep apnea rarely. They come with the typical symptom of daytime drowsiness. And after doing a polysomnography, we find there is significant OSA. So the symptoms also has to be taken care of, but it is more common amongst obese people, that is for sure.
So Dr. Saab has let us know that don't sleep on your back. He says,
Yeah.
if you have sleep apnea, don't sleep on your back. Turn to the sides and sleep. If you turn to the sides and sleep, and if you remember initial pictures, the tongue doesn't fall back on the breathing passage. So sleep on your sides if you are snoring and if you stop breathing in intermittently, and that may be one of the suggestions. Dr. Saab, last question. Is there any role of yoga or some exercises to control it to some extent or to an extent?
There is no exact research that has proved that any particular yoga can actually cure sleep apnea, but definitely the lung function can improve. The pranayams and the breathing exercises that are associated with yoga can help in improving lung function. Especially, there is one more issue that I want to highlight, is that patients who actually are in the habit of taking alcohol, they should not take alcohol, stop the last peg and then just go to bed. They must keep a gap of at least 1.5 to 2 hours. Having drinks and going to bed immediately will increase the sleep apnea manifold. So this is one of the important things for people who take alcohol, like don't after just taking the last peg, go to bed immediately. Keep a gap.
I mean, entire purpose of taking alcohol is to sleep afterwards. अगर आप बोलेंगे 2 घंटा वेट करिए तो बहुत से लोग तो पीना ही छोड़ देंगे डॉक्टर साहब.
No, but the sleep apnea, the effects of sleep apnea is much more severe after anything, after any sedation, and that also happens in cases of patient going to OT or surgery. Patients who are not known to have, who are not diagnosed with sleep apnea, and then they are given anesthetic. After giving anesthesia, they just don't wake up. So that is one of the issues that has to be taken care in patients who are undergoing surgery. As a routine pre-anesthetic checkup, one has to exclude the patient does not have sleep apnea, or even if he has a sleep apnea, that has to be taken care of by a post-surgery, post-anesthesia CPAP or BiPAP.
Obviously, it's very clearly established कि रात में जो आपको खराटे लेने की आदत है, it is not a very simple process. It disrupts what Dr. Das has said. It disrupts your sleep. Sleep is a very complex procedure, and you don't go to that depth of sleep. You just sleep superficially. As a result, you are never rested, and as a result, your oxygen level is never normal like any other person's. So you have suffered a lack of sleep, which you compensate in the daytime. You fall asleep in the daytime to compensate or overcompensate for what you lost in the night. That can lead to many complications, which he has mentioned in lack of symptoms, lack of concentration, lack of libido, irritability, lack of ambition, so many things. And also, they are not just simply lack of your problems in real life. It also leads to a lot of disease. So my friends, I think it has been a hugely beneficial to me as well. I also learned a lot of things by talking to Dr. Das, and I'm sure you all will learn. I specifically like to address to the women of the house, please take care of your husband. If they are snoring in the night, don't ignore. They need to be brought in.
And the husband should also take care of the wife.
Yes. So what is the sex difference, sir, between the husband and wife? Who gets male and women? Who gets snores more?
Male are known to snore more, at least 3 times more commoner than female. But female sleep apnea is also common. But as you know, that diseases are more or less neglected in women more than in male. Any particular disease, call it asthma or anything, the male child gets the better treatment than the female child. That is the issue here. So here also, The female sleep apneics, they come to medical help at a later time. So that has to be that has to be taken care of. The male partner must also realize that if the wife suffers from all the symptoms that I have mentioned, bring her for a checkup and to take adequate treatment.
Thank you, Dr. So please take care of each other. These small tips we bring you every week. I'm extremely grateful to the Bengal Chamber of Commerce and Rotary Club of Calcutta, Vienna for taking our message to your people and the public at large. And we're getting huge feedback. Please write to us. Please send your messages on 7439600616. Send a WhatsApp on 7439600616 with your views, with your questions, with your some of the topics which you like us to cover. And I'm sure that by listening to us, by implementing some of it, you will stay healthy. That's the purpose of this webinar. Health is the ultimate wealth. Have a nice weekend. Namaskar. Thank you, Dr. Das. Thank you, IT, and thank you all those who joined us.